All. This is Dr. Mubin Sayed from drbeen.com. Welcome to one more show. So, the discussion today is about the long COVID and the extracorporeal um, apheresis or blood washing and any effect of that for especially the chronic fatigue syndrome or the post-exertional malaise and or post-exertional malaise. The study is coming from Germany. What they say is, so the same team has done two studies. In one study, they proved that improving the various biomarkers or inflammation or inflammatory state in long COVID patients improves their clinical outcomes or improves their chronic fatigue syndrome. In this study that I'm going to present today, these researchers were curious that when the patient feels better, what are the most prevalent biomarkers that were high and that got reduced with this intervention and may have an association with the clinical outcomes. Mind you that the study does not create a causation to say that these biomarkers, for example, CRP or interleukin 1 or interleukin 6 or some antibodies, they're not saying that these biomarkers are necessarily the cause of the chronic fatigue syndrome or post-exertional malaise of long COVID, but they feel that when these biomarkers are reduced as a result of the blood washing, apheresis, then maybe they have a role in the pathology as well. And I think that that is true. So let's look at this. Before we look at the study itself, it is from Dresden University, Germany. They partnered with an apheresis company. The apheresis, there were two sessions done. Each session was on average 140 minutes, 2.5 hours to 3 hours. And the price was 2,300 euros. So I do not know that if they have a discount or not. However, the question that is important for us to note, and Alexander here in the comments was talking about this as well, that there are some other doctors who also have this intervention that they offer. And the intervention does not really treat or cure a person, and it makes sense. The reason for that is that these biomarkers that are elevated, the antibodies that are present, the inflammatory molecules that are running around in the body, the blood flow issues that we are seeing, the clotting issues that we are seeing, there is something underneath that is causing that. So if we wash the blood and remove some of those, that does not mean that we would fix the underlying pathology. It will give the patient a break. That's what Alexander was saying a few minutes ago as well. It gives the patient a break. And now there is some of my commentary as well. So let me not put this all in his name. It gives the patient a break. It allows them to step back, figure out what's going on, have a temporary relief at least, and then work with the doctors to figure out the next plan of attack. That is one. Secondly, in some patients, this is too debilitating a situation that they need reduction in symptoms to start operating and thinking straight and planning for their life and hopefully have reduced helplessness and have slight improvement in their psychological outcome. And then a very important thing is that if there is a blood flow issue underneath the malaise, post-exertional malaise and chronic fatigue syndrome, then there may be continuous damage, ongoing damage to the tissues happening because of the blood flow and viscosity issues. And so maybe blood washing would allow that flow to improve, viscosity to improve, and the tissues are prevented from getting damaged while doctors are trying to figure out what is the solution. And talking about that on this channel on YouTube. There are tons of talks that I have done about various possible pathologies and their possible explanations and curative methods or interventions. These are also present on drbeen.com as well in chronic inflammatory diseases section. So if you get access there, you can get access to these lectures as well. And they are present here on YouTube too. So with this, let's start our discussion. So this is drbeen.com. In the description of this video, there is a link to get access to drbeen.com and to its beautiful, extensive library. Over here, you would see, do you see here this chronic inflammation? So if you go here, there are many of the chronic inflammatory disease conditions and their discussion over here. I am specially continuing to add to this area while other doctors, for example, Dr. Tom King is working on dermatology, Dr. Faraz Bhatti just finished the emergency medicine. Now he's working on the cardiology section. I am also working on microbiology section. We are just uploading anatomy. These are all anatomy structures. And can you imagine you can get access to all of them for a very low price? So get advantage of that. Now, here is, before we go to the study, what are the symptoms of chronic fatigue syndrome? So this is really myalgic encephalitis and chronic fatigue syndrome, or MECFS. These have very much overlapping symptoms with long COVID. So if you see here, other than fatigue, there may be extreme exhaustion after physical or mental exercise, problems with memory or thinking, dizziness that worsens with moving from lying down or sitting or standing, muscle or joint pains, unrefreshing sleep, and there is much more. Headache, sore throat, tender lymph nodes, neck and armpit lymph nodes swollen or painful, and more. Here is the study. Clinical improvement of long COVID is associated with reduction in autoantibodies, lipids, and inflammation following therapeutic apheresis. So here, what is important to note, not that apheresis itself is a great thing. It is an extracorporeal invasive procedure. It is useful in some patients, very useful in some patients. However, important finding that they're putting in front of us is the following. They found that clinical improvement occurs when autoantibodies are reduced, that are increased in long COVID, and they talk about 4 of them. We'll talk about them. When inflammatory markers or mediators are reduced and lipids are reduced. So that is the important part here. This is their previous study where they did the apheresis or blood washing, and they looked at the post-COVID syndromes and saw that there is an improvement. Then I do not want to name a specific apheresis company because this is not an ad for them, but you can read the study to see what are the companies. And if you wanted to see what is apheresis and how the procedures are done, you can read it up as well. Now let's go to my drawings and we would see what the summary or a high level understanding of this this lecture. And my pen is not working today. My computer is acting up, so give me 1 second. I'm gonna stop sharing for a second and I'm going to disconnect and reconnect my tablet system. My tablet system actually is so funny, has become broken after working on it extensively for 3 years. Its connections have become a little less reliable, so I should buy a new one. So 1 second, please. Okay, all good. Okay, so back here, we are good. So these are gifts for humanity and they are continuing. Yesterday, I did this Japanese talk or they talk about the condition in Japan, where I translated gifts for humanity, and turned out that it translated into gifts from humanity. So I guess as we all work together to produce them, these are gifts for humanity from humanity. Okay, so this is a study which I just showed you. Here is what's happening. They looked at two specific type of symptom sets. One was the chronic fatigue syndrome, and the other one was post exertional malaise. And what they had was that they had 127 patients, out of which they eventually used or selected 27 patients for the apheresis. These patients had at least 12 weeks of long COVID symptoms. What they did was they did the therapeutic apheresis or extracorporeal apheresis, where they would take the blood out, they would then process that or clean that blood. Now, there are many methods to clean the blood. There can be a centrifugation that can be done, or there is adsorption on various beads that can be done. And as part of that, uh, autoantibodies or antibodies can be cleaned out. Some inflammatory molecules can be cleaned out. Some thrombi can be cleaned out. Emboli can be cleaned out. So there are a number of things that can be cleaned out. So what researchers do is that they look at a patient's blood before, if they are researching this, and then they look at the patient's blood after, and they try to figure out which molecules and proteins have been removed. Now, of course, trying to figure out every molecule that got removed and every protein that got removed is a cumbersome process. So researchers in this case, they had a hypothesis first to say, we want to look at C-reactive protein, we want to look at interleukin 1, interleukin 6, we want to look at autoantibodies against adrenergic receptors, which are helping us with the blood pressure maintenance and heart rate maintenance and GIT function, muscarinic receptors M3 and M4, which are also helping with the blood pressure and GIT functions and the urinary system functions and so on. So they had certain molecules and proteins and antibodies that they were targeting, and they measured them before and after to see if that helped. Then, of course, if the patient is feeling better as well, then that means that whatever molecules are reduced have some association with the disease as well. Now, it is possible that there may have been other molecules removed, other antibodies removed that they did not measure, and they were those other molecules and antibodies or proteins were also associated. So that is one of the limitation. So they did the therapeutic apheresis, 2 therapies with 3 weeks interval between them, 114 minutes on average for one therapy, and they also administered 8,000 E of the heparin. 27 patients, 14 men, 13 women. Mean age for men was 49.7. I believe their BMI was somewhere about 26. Mean age for women was 44.9 years, and their BMI was 21 point something. And these patients had immunopathies, that is immunological issues, MECFS-like symptoms, intestinal dysbiosis, and polyneuropathies. So multiple symptoms were present. What they did was they did apheresis on these patients, but they would take their blood before and measure these molecules and antibodies and proteins and antibodies too. Then they would do the apheresis and measure the same things afterwards as well. So they would collect blood before and after. What they were looking for was CRP, C-reactive protein, inflammatory mediator, or actually a protein which is called acute phase protein, that when we have acute inflammation or attack of a disease, inflammation for some reason, then the C-reactive protein is released by liver to try to help the situation. Interleukin 1 and interleukin 6, we have done in extensive talks about these antibodies and adrenergic receptors. So they looked at the antibodies against adrenergic receptors beta 1 and alpha 1, beta 1, beta 2, and acetylcholine receptors M3 and M4, or muscarinic receptor M3 and M4. These are various receptors that are present, as I said before, in our blood vessels, GIT, heart, and they can cause dysfunction that would cause blood pressure changes, that can cause tachycardias, that can cause GIT issues, that can cause urinary system issues, and so on. So they were looking at antibodies against them. They were looking at lipid levels before and after, and they were looking at thrombotic factors, for example, fibrin and homocysteine. They also looked at H2O2. Then they also looked at red blood cells through the microscope to figure out if the red blood cells were forming rouleau formation. Rouleau formation is where the red blood cells, they can stack up with on each other like stack of plates and form a rouleau. And these are not a good thing, because when the red blood cells form stacks, they would increase the viscosity of the blood. That would cause the reduction or obstruction or change in blood flow dynamics, which would change blood flow to various tissues and can cause real problems. So they looked at that through microscope. Now the clinical aspect of this, they had done this study of apheresis and the COVID-19 long COVID patients, and had observed that there is an improvement in those patients after apheresis. So what they have is they have a FACET F questionnaire, and that questionnaire is actually available online. That the link is in the study of this study. Then they measure the degree of fatigue. They also did a visual analog scale to measure the tiredness of the patient. Now, this is an important paragraph. They said, in conclusion, this study clearly shows that extracorporeal apheresis is a powerful technology to reduce biomarkers that have been implicated in the pathogenesis of post-infectious syndromes such as long COVID. This, however, describes only an association and not causality, and a clear correlation with symptoms and improvements of patient. So they're saying that we are observing that after apheresis, patient feels better. Now we are also observing that here are the molecules and antibodies and proteins that are reduced. So there is an association between these two factors, but this is not a causality, or this is not a correlation with the symptoms to these antibodies or these substances. Therefore, an additional limitation of our and similar studies is the current lack of hard endpoints for clearly defining and measuring improvements in long COVID symptoms objectively. Nevertheless, the study provides some guidance for monitoring treatment success and for establishing a large patient cohort with a score of several of these parameters that will correlate with the immediate and long-term outcomes. So once again, after reading this, if I go back here, this is an important set of markers to keep an eye on. I actually believe that in addition to this, anti-ACE2 antibodies, then anti-ADAM antibodies, then anti-nuclear antibodies need to be looked at as well. Interestingly, that company that does the anti-ACE2 antibodies was also used, their testing was used for these patients as well. So this is important from the research point of view to say, hey, if somebody has these symptoms and they are doing therapies, look at these markers to see if they're improving or not. Now, let's very quickly look at some of the markers together. So I'm going to, instead of having to draw this because they had a lot of graphs, I think that we can look at it together. So first of all, These are the neurotransmitter antibodies are reduced after apheresis. So here what they are seeing is, if you see beta 1, beta 2, M3 and M4. Beta 1, beta 2, M3, M4 are these are receptors, as I said before, that are present in blood vessels, heart, GIT, and other places. And they are neuroreceptors, that is, they are uh, busy or helping with the sympathetic and parasympathetic controls of these organs. So if you see here, the black line is the before apheresis. The gray or light dark line is after apheresis. The dotted line is the normal level expected. So if you see here, in most of the apheresis, the result after the apheresis brought the line near the control or normal, except in the case of beta 2 and in the cases of M3. So beta 1 and M4 almost became normal after these two interventions with apheresis. Then, if I continue here, look at this one. This is inflammatory and oxidative factors, and reduced factors are reduced after apheresis. So here, if you see interleukin 1, interleukin 6, and CRP, C-reactive proteins. So once again, the same method. The dark line is before apheresis, the dotted line is the normal level, and the light gray is after apheresis. So here, if you see, IL-1 is reduced below normal, so the blood is cleaned enough that enough IL-1 is removed. Interleukin 6 almost towards the normal, and C-reactive protein much better than what it was before, but not towards entirely normal. Here, if you see the reactive oxygen species, which is really important, and once again, they cleaned blood enough after these two interventions that reactive oxygen species almost went below normal. In H2O2 as well, which is part of the reactive oxygen species. Now, this is interesting. So my cartoon for this diagram, if I can show it to you again, was the following. I actually wanted to make a cartoon where the red blood cells are kind of shying away. But anyways, while we are looking at them, so this is a rouleau formation of the red blood cells. So how in reality it looks like under the microscope, this diagram here is the rouleau formation. Can you see that the red blood cells are stacked as if these are plates? So when they're stacked like this, these red blood cells would cause increase in viscosity or reduced blood flow velocity, which would cause problems in the tissue perfusion and tissue's need for nutrition and removal of the waste products. At the same time, you see these little galaxy-like things. So these are fibrin monomers that are also present in there. And now if you look at the diagram below, which is after, there is no rouleau formation and there is no fibrin observed. So that's a very, very good result. On the left side, if you see here, fibrinogen is reduced plus homocysteine are reduced. Remember homocysteine and its increased level? I did a talk about homocysteine a few days ago. Homocysteine, when increased, it is a controversial topic. Some folks agree to this and some do not, that homocysteine is involved in cardiovascular health issues and clotting issues. So this is the effect on blood, which I think is very important. Then apheresis reduces lipid levels. Now, in the long COVID patients and also in the ME/CFS patients, lipid levels are an indicator of inflammation. So here, if you see various kinds of lipids, cholesterol, triglycerides, LDLs, HDL, lipid A, they're all reduced. So look at before, then the normal line after. Once again, I'll remind us, or you may be already thinking this, that this is blood washing. This is not removal or fixing of the original pathology, the underlying pathology. However, it does provide a break to the patient, improves them, does allow the doctor to think back because the patient is not doing the firefight. And then also, if the damage to the tissue is occurring because of the blood flow issues or continuous inflammation, then that damage can be reduced or stalled or stopped with these blood washing techniques. And then they have their study over here, or the discussion of that. So this is the discussion. Will this cure long COVID? No. But those patients with neurological symptoms, with cardiovascular symptoms, with chronic inflammation, with the post exertional malaise, with chronic fatigue syndrome like symptoms, they would have a benefit. However, extracorporeal, which has its own pros and cons, extracorporeal, you bring the blood out, you process it, you put it back, expensive. In Germany, I'm not sure. I think that FDA had approved something here in the US as well. I'm not sure which intervention is that. However, it is, this intervention is in Germany. So this is the, sorry, this paper uses 1 for 0.05 and 3 for 0.001. Well, thank you very much, Paul. And so this is the discussion. Thank you very much for listening in. Tomorrow, I will not be lecturing because tomorrow we'll have 2 Zoom sessions for those super beans who are supporters on YouTube or Patreon or Substack. So we'll have 2 Zoom sessions and we'll discuss other topics. So I would see you on Thursday. Stay safe, happy, and healthy, and bye for now.